is episode 60 of the Fire Protection Podcast, powered by InspectPoint. Today, my guest is Jim Kendig from the Joint Commission accreditation organization. Joint Commission is obviously big. If you're doing anything in healthcare within fire protection or security, you're going to know about Joint Commission. Any essentially healthcare facility in the United States and beyond have to utilize it. So it was great to have them on. I've been wanting to have Jim or somebody on for a while, and I got recommended that he's a great speaker. It was awesome. He put together kind of a podcast. It's more presentation, so I highly recommend looking at this on YouTube, because we do follow PowerPoint throughout the whole conversation. Essentially, it's Jim kind of explaining who the Joint Commission is and how they go through the process with the healthcare facility, what's involved in the survey, where does fire protection and security involved in that. We go over some top findings over the last really just 3 months, but what they're really finding and they're looking for. So it's great data, great statistics, and this kind of kicks it off. Well, InspectPoint's going to be doing a webinar on healthcare and our capabilities within InspectPoint. So this is happening on April 24th at 11 a.m. Myself and 3 other great fire protection and Joint Commission healthcare fire protection experts. So it's cool to have them on. The link is bit.ly/InspectPointJCO. And then you can sign up for that webinar. So on to the podcast here. And thanks for Jim coming on. And please like and subscribe onto the podcast. All right, we are live here, Fire Protection Podcast. I've got Jim Kendig from the Joint Commission on with us today. Been wanting to discuss obviously any healthcare compliance and kind of what the Joint Commission's been doing over the years. And I know we get a lot of questions, obviously with our company and the software and how we can help, but would love to kind of give an update of what you guys have seen over the last few years, any tips and tricks, and welcome to the podcast, Jim.
Well, thanks, Joe. Really appreciate it. Appreciate the opportunity to share some updated information from the Joint Commission. So let's get right at it. Just a quick disclaimer. Of course, we do not endorse or promote any company products or services, and these slides were updated for this presentation exclusively during March 2024, and typically they run through 3 of 2025. So just a heads up on that. The Joint Commission. Let's talk a little bit about the Joint Commission, what we do and how we do it and all that stuff. So our mission, obviously, is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe, effective care of the highest quality and value. And of course, our vision is that all people always experience the safest, highest quality, best value healthcare across all settings and locations. We do this by setting quality standards, evaluating organizations' performance, providing an interactive experience that provides innovation, solutions, and resources to support continuous improvement. So we are called the gold standard. There's a reason why we are called the gold standard. Seeking Joint Commission accreditation requires some diligence on the customer's part as well. We set the global standards. We shape the best practices and establish the most rigorous standards to raise the bar of performance. We have unmatched reach and insight. We work with tens of thousands of organizations, giving us powerful perspective into delivery of healthcare around the world, not only in the United States, but around the world. Few accrediting organizations have that ability.
Huh.
We'll give you an intensive review. The Joint Commission surveyors are amongst the most experienced in the business and come from a variety of healthcare industries. They are matched with your organization based on their background. For example, our academic medical centers get academic leaders and physicians and nurses, whereas our critical access hospitals get folks that have worked with critical access hospitals in their previous employment. So they understand the role of those organizations. So again, we set the gold standard. Again, A lot of other accrediting organizations are available, but we believe we provide the best value and the gold standard for accreditation for deemed status. Deemed status means getting support from CMS, Medicaid, Medicare. Non-deemed would be something like the Veterans Administration or state hospitals, perhaps.
Yep.
We help you attract the best personnel. Joint Commission accreditation can attract qualified personnel who prefer to serve in Joint Commission accredited organizations. We can accelerate progress through collaboration and communication. We'll help you connect with like-minded organizations and facilitate knowledge sharing to increase awareness and inspire action on issues affecting the quality and safety of patient care. We'll push you beyond accreditation. Through our certification programs and affiliates, we provide practical tools and resources to support your continued improvement to help you maintain performance excellence, not only after accreditation, but during accreditation and pre-accreditation. So it's across the board. We want to partner with you and walk shoulder to shoulder to improve healthcare opportunities in your communities. Who do we accredit? Well, we include a continuum of care that includes hospitals, critical access hospitals, doctors' offices, nursing homes, office-based surgery centers, ambulatory surgery centers, laboratories, behavioral health providers, and providers of home care services as well. We also have disease-specific certifications as well for those seeking disease-specific certifications.
Nice. Yeah, I've seen, just to interrupt you quick, Jim, yeah, we deal a lot in fire protection with across with our software solution. And I think 90+% of any healthcare fire protection inspection, right, is always Joint Commission. So you guys are definitely the gold standard, have a really nice, rigorous process to make sure your T's are crossed and your I's are dotted. So,
and it's all about the patient, right? So the most important piece of medical equipment you can have is the building. If the building can't function, critical pressure relationship areas, vacuum, electricity, plumbing, sewage, power, water. If you can't provide that to our clinical leaders, we can't take care of patients well, right? So that's all about the patient.
Yep.
Let's talk about some of the leaders at Joint Commission. My name is Jim Kendig, and I'm a field director for the Life Safety Code Surveyors. I've been on with Joint Commission about 13 years now, and about a decade of being the field director. Became the first field director ever over the Life Safety Code Surveyors. We used to report to physicians and nurses. My colleague, Tim Markey-Judd, he's also a field director for the Life Safety Code Surveyors. We split about 45 surveyors each. So he has 45 and I have 45 as well. Herman McKenzie, he's our director of the Physical Environment Department. You may have recalled that he was part of SIG, Standards Interpretation Group. Now it's Physical Environment Department, and is part of Accreditation and Certification Operations, which is ACO. That's where all the surveyors sit, the reviewers, the account executives, all the folks that are forward-facing to our customers. We're going to cover a couple different things here that Drew asked me to cover. So preparing for a survey, EC 235, which is part of our document review, facility orientation, building tour, top 5 life safety code findings, and some additional information. Dr. Jonathan Perlin, our new CEO, created this to provide frontline staff an understanding of the Joint Commission accreditation survey process. Again, on the left side, where do standards come from? Well, we have them coming from CMS, OSHA, of course, and the Joint Commission. It talks about the survey experience as well. So this was designed to be provided to frontline staff to understand Joint Commission and how we accredit organizations. So please share this with your customers, colleagues, etc. Let's talk about preparing for the survey. Preparing for the survey, some resources. We have the Surveyor Activity Guide, or what we call affectionately the SAG, the Surveyor Activity Guide. The SAG is provided free to our accredited customers, and in that, it talks about how we survey various elements of the survey process. In there is a kitchen checklist that we developed to make you successful. 2 pages for clinical, 1 page for the life safety code surveyor. So we're actually giving you the information to make you successful. So when you're on survey, we're going to walk through with that checklist as well. And we'll look at the fire drill matrix a little bit. This gives us an opportunity to provide you a resource and fill it out for us to take a look at your fire drills very, very quickly instead of flipping over a white piece of paper, drawing all kinds of columns, etc. So we don't want take time in doing that. So fire drill matrix there. Standards and elements of performance can be found in the various manuals we have for hospital critical access, hospital ambulatory surgery centers, behavioral health, nursing homes, or our NCC program, etc. Perspectives is a monthly publication from the Joint Commission that gives you updates and is the go-to document for information on a monthly basis. Mock surveys, many folks use Joint Commission resources and others to help them during mock surveys to prepare for a survey. And of course, www.jointcommission.org, you can provide resources there.
Hey, Jim, just quick question, and sorry to interrupt. How often do the surveys happen? Is it a certain cycle?
Yeah, every 3 years. So it's a triennial survey. Now, there are other survey events for early survey options. There's extension surveys. Let's say you just build a 300,000 square foot heart center, you attach it to the building. Well, we would take a look at that as an extension survey and assign a clinician and a life safety code surveyor because it's never been surveyed before and it's just recently built. So we would send some folks out to take a look at it. But your normal full unannounced survey is every 3 years, or what we call a triennial survey.
Perfect.
Talk about the facility orientation is usually from 8 to 9 a.m. And that's where the life safety code surveyor gets with the director of facilities and perhaps his team. And we take a look at the fire alarm panel that serves the fire alarm, and of course the breaker that is a panel that serves the fire alarm system. So we want to make sure that that's red, the breaker's red. We also want to know where it's served from, and also we're going to take a look at that life safety branch to make sure nothing's inappropriately assigned to the panel there or to the branch. So we're going to look at the fire alarm panel breaker for supervisory signals or troubles. We're going to take a look at the fire pump, determine whether it's electric or diesel. We're also going to check the number of spare sprinkler heads and the wrenches to replace them. So we're going to check that and make sure that that room is not in excessive heat over 100 degrees Fahrenheit. We're going to take a look at generators or generators. There may be one, there may be many, right? So, and they may be scattered around the campus depending on when they were installed, and of course, as the building gets renovated and updated. Bulk oxygen, take a look at that per NFP 55. We're also going to do an orientation to the life safety drawings. We're looking for chutes. We want to see smoke compartments, suites, architectural suites. So we're trying to get an orientation of the building. We're going to take a look at your written fire response plan, for example, to determine what licensed practitioners have them do in that written fire response plan. And you can turn off the medical gas zone valve. Years ago, when we had NFP 9999, it actually had information in the appendix about who suggested, of course, it's in the appendix, who could turn off the medical gas zone valves. We're going to take a look at your interim life safety policies. We're going to provide you 3 resources: the fire drill matrix, a list of URLs for additional information, and also the list of ILSMs, the 15 ILSMs. So if we find something or cite something that cannot be corrected immediately, you would implement ILSM, and it's up to you, the organization or the customer, to choose that ILSM from those resources. 3 questions we asked during the orientation: what type of fire stop do you use? It could be Hilti, STI, 3M, anything like that. We just want to know when we go up in the ceiling what we're going to see. In addition, the follow-up question is, how are you training your staff on the application of the fire stop material? So, Drew, I think this is head on what you guys talk about a lot. So the first question we ask is, what type of fire stop? How do you train your folks? I even had security training. So every year I bring in whatever vendor I had, bring them in, and they do a 90-minute session. We'd go over the technical bulletins, right?
Right.
And take a look at the application of that. The next question we ask is, can we access the interstitial space above the drop-in ceiling? Some organizations require us to use a HEPA system where we put it up to the ceiling, and only then can we remove the ceiling tile, right? So
Oh, interesting.
making sure that, so again, we don't open ceiling tiles in ORs, transplant
Right.
units, ICUs, because we don't want dust and debris coming down and getting someone sick with aspergillus or something like that.
Right.
So we ask them about the access to the interstitial space above the drop-in ceiling. And the last question is, what are you using for high-level disinfection? The reason why we ask that is engineers, we want to make sure that they have the correct number of air exchanges for the particular product they're using, so we don't get folks sick, right?
Right. It's all about the patient.
Building tour. Day one, we talk about the facility orientation. Document review is in the appendix. We go through LSO 10101, EP3, which is the orientation to the drawings, making sure it has certain elements. We typically go to EC 235. That's a list of 28 inspection, testing, and maintenance, whether it be fire alarms, sprinkler systems, fire department connections, et cetera, dampers, all those things. We take a look at the inspection, testing, and maintenance activities. After that, that takes about an hour and a half to 2 hours. We're going up to the ORs. We're going to check the critical pressure relationship areas in the ORs, the C-section rooms, SPD, sterile processing department. Why do we do that on day one? Well, it allows an organization to fix it if we find something that's inappropriate. For example, OR1 is negative. It should be positive, right? So we want to make sure that that flow of air is coming out, not in. After that, we usually go to lunch, and then we start at the top. We'll work our way down. We start at the helistop or helipad at the top. NFPA, I think it's 418 if it's new, and then we just work our way down. We also look at exhausts. NFPA 45 under 13 and 13A talk about specific requirements for the hood exhaust or the exhaust on the roof from laboratories. And 13A or A13 has specific language that's recommended from NFPA 45. So we start at the top, we start at the roof if we can, and then work our way down, going to 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, basement, sub-basement, all that kind of stuff. We have a hard stop at the end of day one. This is to review with the group that we've been with all day, any IOUs, right? So you couldn't find a particular document. Things that we found on the building tour that were scored, and things that were found on the building tour that aren't scored, that maybe we have to do some homework or you have to do some homework to take a look at. So we kind of an end of the day summary. Day two, we do a morning briefing, out briefing with our team. After that, we go meet with our facilities group and we look at IOUs, talk about the continuation of the building tour. And then of course there's an exit or interim exit. Typically about 90–95% of our surveys are 2 days. Once you get above 1 million square feet, they go to 3 days.
Hey, Jim, I got a quick question on the, like, just documentation in general. Is there any best practices that you've seen just to make sure everything's, ready for you guys, documented, digital, paper, obviously organization is key. You don't want to be fumbling through everything.
That's a good question. Yeah. Question we get often. So it could be paper, it could be electronic, it could be a mix of both. But the problem is, if you don't have someone that drives the electronic system, it could be very cumbersome. You could be in there 4 or 5 hours, at which time we're going to say, you really need to find somebody to drive this system because we don't have time. We don't have that time to waste. So it could be any format you want. It could be electronic, paper, combination, but make sure that you have someone that can drive that very efficiently, right? So we want to be efficient with our time. So no matter what medium you're using, we want somebody that can drive that quickly.
That's a great point.
I pulled together the top 5 life safety findings from January 1, 2024 up until this week. So let's go through those real quick. LS2135 EP4, this is piping or other things resting upon, affixed to, or draped across the approved automatic sprinkler system, right? So if you couldn't put a business card through it, you have some HVAC ductwork resting on that. We don't want that weight of the HVAC ductwork on the approved automatic sprinkler system or anything. For example, something tied to it. LS2110 EP11 are fire-rated doors within walls and floors have the appropriate hardware on there and positively latch upon closing. LS2134, EP9, the ceiling membrane is installed and maintained. So we're walking down the hall and we see 3, 4, 5, 6 ceiling tiles removed. Well, there's no suppression or detection systems above the interstitial space above the drop-in ceiling, right? So we want to make sure all products of combustion, fire, heat, etc., are maintained below that membrane. So that's being scored. And there's a different score between corridors and rooms. And that's very, very important because we don't want that hot air products of combustion above that because it takes longer for the suppression system or the detection system to activate.
Yep.
LS2110 EP14, this is penetration. So we have a penetration through a particular firewall. Remember we talked about our discussion about the fire stop. And typically what we see is that, Drew, that these conduits are 99% full. And if you look at some of the technical bulletins from some of the manufacturers of fire stop, they say about 46% full, right?
Right.
But what's amazing with these vendors is that they're coming up with unique ways where they have collars and can take care of issues already there. And so I got to applaud our fire stop contractors. They're really doing a great job coming up with solutions to address these issues. And lastly, LS2130 EP13, all corridor doors are constructed to resist the passage of smoke, etc. So that rounds out the top 5. And we typically, when we speak at larger organizations, we can speak at your organization virtually, in person, etc. And we customize our discussions around what you want to learn. So this was LS based. We also have the top 5 environmental care, top 5 emergency management, top 5 security and workplace violence as well. So this really focused on the life safety findings.
Yeah, I like that. What you mentioned before about, those questions that you ask when, you asked a question about, fire stop. Do your questions, over time, have they changed because of maybe you find more things out that, hey, I want to be ahead of this, so I'm going to ask that question.
So, sometimes in that top, let's go back to it real quick. So those top 5, we actually look at routinely the top 10. They switch places.
Oh.
But we're seeing more and more. I've just been on some recent surveys where they're doing a better job with penetrations.
Okay.
Where they have 0 penetrations because they have an above the ceiling permit process, right? So the contractor vendor that's pulling the wire, the security vendor, or the IT vendor, they have a process in place to go behind them and check that all those penetrations were addressed, et cetera. So we're starting to see much better use of the above ceiling permits, which would reduce the number of, number 4 there, the penetrations on the LS211014. But so just want to give you some idea on the SAFER matrix. Here's some definitions. This comes from our accreditation manual, page ACC 46. So this is kind of some of the definitions. And then when we apply it to the SAFER matrix scoring. Again, this is 1124 to 32524. And you can see an immediate threat to health and safety. This was related to LS121 EP1. The organization did not have ILSM, interim life safety measures, applied for a significant life safety issue, whether it be the sprinklers are down, the fire alarm, sprinklers are down, the fire alarm system is down, or a combination of both. So this was an immediate threat to health and safety. So high is 1.1%, moderate is about 18, 19%, low is about 80%. That's exactly where we want to be, in the low, limited, pattern, and widespread, right? We want to be low limited. These issues are not impacting the patient. So as you go top right, up into that 0.0%, that reddish color, far right, that's when you have the ability to impact patient safety. We typically see infection control scored in the high area and the moderate areas. So as you go up the SAFER matrix, you have an increased opportunity to impact patient safety. Just want to give you some idea of the average findings during a survey. So you can take a look at here that we had a couple of different things. We had, back in the day, 2014 to 2016, we had C categories, or opportunities for improvement. They were in the back of the report and didn't really count. Then we had it from 2017 to 2019, we had SAFER, which I just illustrated, and the See It, Cite It kind of thing. Then we had COVID from 2020 to 2022. And as we know, the public health emergency ended 5/11/2023. So we'll see some more data about 2024 as well. But you can see the average number of findings per survey. What's new in trouble spots? We have a new sustainability certification. This was led by my colleague, Tim Markeyjohn, the other field director for the Life Safety Code surveyors. So effective January 1, you could get a sustainability certification. And I think the state of Massachusetts, all the hospitals are seeking that, I believe, but I may have misheard that. But anyway, this is available to organizations if they want to get this sustainability certification, either as a system or individual hospitals. So you can get additional information as you can see in the article. And this was published in the Environment Care News, February of 2024 on page 6. And during our annual surveyor conference in January, all the life safety code surveyors were trained to survey this sustainability certification at our annual conference. Just a plug for our 2024 Emergency Magic Conference. It's in Orlando, Florida, June 19th to 20th, if you're interested in participating.
This is on the back. That's right around NFPA. NFPA is doing their conference in Orlando the same time.
Cool.
Yeah.
Tethering and chocking of wheels. This comes up often, Drew, as far as when we get in the kitchen, start surveying. So we take a look at NFPA 54, 2012, 9612. So it talks about limiting by a restraining device in accordance with the connector and appliance manufacturer's installation instructions. So basically, if it comes with it and the manufacturer requires it, the tether has to be in place, right? So we don't, damage some part of the equipment. And of course, chocking wheels is an NFPA 96, 12122. And again, we want to make sure that the positioning of the device, whether deep fat fryer, stove, oven, whatever, is positioned in relative to the extinguishing equipment that is required by the installer or servicing agent. So we just want to provide some information on this because it is a focus area. Because where is the number one location of fires in healthcare? Kitchen.
Kitchen, probably, yeah.
Yeah, NFPA says the kitchen. Yeah. So we want to spend special attention on our K extinguishers, the NFPA 10/2010, 30 linear feet from the deep fat fryers, making sure our kitchen suppression systems are maintained, the baffles, all those type of stuff in the kitchen. Reminder about the 18-inch rule. Basically, we come down from 18 inches from the diffuser, and we draw a plane across the room. And you can see here that this one here in the middle, the OK, is fine, it's blow up, but we put a box on top of a shelf that intrudes upon the 18-inch plane. That would be a finding, as well as the shelf, the entire shelf on the left that goes all the way through to the plane. So 18 inches down from the diffuser, and we draw a plane across the room, and anything in that plane is considered out of compliance. And of course, we know that shelving along the wall can enter the plane, the 18-inch plane. However, the placement of sprinklers cannot be directly overhead that shelving unit on the wall.
Yep.
CMS validation. We used to get CMS validation surveys from either state agencies or CMS. They would come out about prior to 60 days elapsing to do a survey to see what we missed. Now we have CMS actually observing surveys concurrently when we're surveying. So not only do you have a Joint Commission team there, but you have a CMS team that's looking and evaluating the Joint Commission team. So that's a new validation process. These validation events are reported to Congress every year for all accrediting bodies. Fire drill, I talked about the fire drill matrix. So we added a section there, required annual fire drills for the ORs and hyperbarics. So this is the fire drill matrix that we developed that we give organizations to fill out upon our arrival. And we're looking at 4 quarters, not rolling 4 quarters, but 4 quarters. Just a reminder about hyperbaric facilities and fire drills. So take a look at 99, 14.2.454, and 14.2.4.541 about using occupants. Although it's supposed to be measured as far as time, it doesn't tell you what an acceptable time is. A reminder, a life safety code server has been added 1 day each for freestanding emergency departments and ambulatory surgery centers. So not only do the hospitals and critical access hospitals, if they have an ambulatory surgery center or freestanding ED down the road, we're going to send the life safety code surveyor down there after a quick document review to evaluate that space. Typically, it's a lot smaller, 10, 20, 30,000 square feet. So we can do the building tour very quickly in those environments. That is the summation of my presentation, Drew.
That was awesome. I learned a lot. I know we talked before this, and I think, just in general, I think where we sit in a lot of the audience that I talk to is like, they're doing fire protection systems of a wide variety for commercial facilities, industrial, but a big part of the business is healthcare, and there's some, sometimes they don't understand the whole process of the whole survey and all that. They're being asked by their clients, the healthcare facility, but sometimes they don't understand, why, right? Obviously, if they're up and up, they get it. So, yeah, this is great to learn about. Even those findings, those are great to find, and data is always super powerful with making, making efficiency or efficiencies down the line, making sure things are safer. Collecting that data is a big thing, and I love how you guys are obviously constantly tracking that. So
I appreciate the opportunity to share some thoughts from the Joint Commission. And if you have any questions, here's our contact information on the last slide. So feel free to reach out to us if you have a question, comment, or concern. We don't get involved in a lot of construction or renovation activity. Obviously, renovation is Chapter 43, NFPA 101, 2012. But we get involved after the construction or renovation. So we don't provide guidance to typically architects and things like that. I mean, they can read the code as well as we can and are probably very proficient at applying the codes. So, the certificate of occupancy by the state, county, city, and of course, then we come in and do our surveys accordingly. But,
yeah,
the triennial survey is an opportunity to shine, and we want our customers to walk shoulder to shoulder with us to be very successful.
no, this is great. I did have one question. So I talked to my pal Greg Gumberts, and he actually recommended you to come on the podcast and chat a little bit. So I appreciate that. He did I chatted with him a little bit ago, last week, and he made a kind of a comment, with healthcare facilities, before the pandemic, they had equipment that was aging out, right? And then obviously you had the pandemic, and obviously that equipment got even used more, obviously a lot more use out of that. So, a lot of healthcare facilities are in this spot where you have this older equipment, and not just fire protection, but throughout the building. So it'll be interesting to see of how healthcare facilities are gonna, do they replace that equipment, or how do they upgrade it with the struggles they've been having, over the last few years.
Yeah, certainly COVID has had a financial impact on most organizations, as you read
Yeah.
Becker's and other things like that. So, as part of that capital planning process, and again, taking an inventory of your systems and their age and expected life expectancy, and planning for that in the future. So, I'm sure forward-thinking facilities directors have that, and are planning 3, 5, 10 years down the road, 15 years down the road. And of course, as we renovate, Chapter 43 comes into play, and so does the code. So when we do a substantial renovation, we're required to bring everything back up to code, right? The number of air exchanges and all that kind of stuff. So there are some pressure from Chapter 43, and depending on the scope and size of that particular project, that'll have a huge impact.
That's great insight. Well, thanks again, Jim. This has been great. Again, a lot of education for us out there, and in the fire and security industry, and yeah, looking to get some feedback just from our listeners out there, and yeah, again, appreciate all the help here.
All right, man. Talk to you soon.
Talk to you soon. Thanks, Jim. This has been episode 60 of the Fire Protection Podcast, powered by Inspect Point. It's always a fun one to get out. I wanted to thank my guest again, Jim Kendig from the Joint Commission. coming on and kind of explaining the whole process behind what they're looking for in an audit and a survey at these healthcare facilities. So again, please like and subscribe. Give me some comments on how we're doing with the podcast. So thanks again. See you soon.